Thank you very much for the kind introduction and invitation to speak in this 22nd International Nursing Congress of Clinica Alemana. Good evening, Philippines. Good morning, Chile, and greetings to the whole world. Pandemic is a worldwide spread of new diseases as defined by World Health Organization, and it was declared in March 11 that COVID-19 is a pandemic state all over the world. First case of COVID-19 in the Philippines. Patient 1, a 39-year-old female, had symptoms of cough and sore throat and was admitted to San Lazaro Hospital in Manila on January 25, 2020. Physical examination was unremarkable with influenza B, human coronavirus 229E, Staphylococcus aureus, and Klebsiella pneumoniae were detected by PCR on initial NPS or an OPS swab. On January 30, SARS-CoV-2 viral RNA was reported to be detected by PCR on the initial swabs, and she was identified as the first confirmed COVID-19 case in the Philippines. Her symptoms resolved and she was discharged. Her symptoms resolved and she was discharged, and both patients were previously healthy Chinese nationals on vacation in the Philippines, traveling as a couple during January 2020. There are agencies working hand in hand in my country, Philippines. Number one agency is the Department of Health. DOH is the country's principal health agency, and it is responsible for ensuring access to basic public health services through the provision of quality health care and regulation of providers of health goods and services. We have Interagency Task Force, or IATF. It is a task force organized by the executive of Philippine government to respond to affairs concerning emerging infectious diseases in the Philippines. We have local governments to provide the links between the people and government, address its community's problems and concerns, enforce policies, and hold influence over its communities. And under LGUs, or local government units, we have CESO and RESO. Both are responsible for collecting, analyzing, and disseminating reliable and timely information on health status, investigate disease outbreaks and other threats to public health system that generates accurate, reliable, and timely information for decision making. I have here the statistics as of November 25. For the whole country of the Philippines, we have a COVID positive of 422,915. And out of 422,915, we have active cases of 27,745, recovered cases of 386,955, and mortality of 8,215. In Quezon City, where my World City Medical Center is located, as of November 25, 2020, cases for Quezon City, total case of COVID positive patients, 35,803, with an active cases of 1,428, recovered cases of 33,733, and mortality of 642. In Marikina City, as of November 25, we have 6,290 COVID positive cases, active cases of 307, recovered of 5,843, and mortality of 140. So as you can see in the graph, in Marikina City, the peak of COVID-19 positive patients or citizens was in August 2020, and both in Quezon City and Marikina, the cases are declining from September to November 2020. In our very own institution, World City Medical Center for inpatients, as of November 10, our positive cases has a total of 210 from February to November 2020. As you can see in the graph, there is a peak of COVID-19 patients in July and declining. The numbers are declining from August to November 2020. For cases in outpatient department as of November 10, we have a total of 312 positive cases from March to November 2020. As you can see in the graph, it peaked in July 2020 and declining. The numbers are declining from August to November 2020. And it is very notable that by November 1 until November 10, we have 0 case of COVID positive 19 patients for OPD cases. Our hospital devised a simple hospital process for suspected and confirmed COVID-19 patients. We start with triage, wherein everyone will be screened. Then patients are referred to Infection Control Committee and COVID Task Force. Then we will proceed with emergency room management. In the emergency room management, it is subdivided into 2. The process of admission to COVID ward and process of admission to suspected COVID ward. If you are positive to RT-PCR, directly you are admitted for routine care or ICU care in a COVID ward. When you are suspected for COVID-19, you have symptoms for COVID-19. If the test of RT-PCR results is negative, you will be transferred to regular clean ward or clean ICUs depending on the case. However, if you were found to be positive to RT-PCR, you will be admitted again to a COVID ward. The first case of COVID-19 in World City Med, he was 71-year-old male presenting symptoms of cough, colds, and body pains, which started March 12 in 2020. Chest X-ray was done and admitted in March 15. First swab was done in March 15. Then the result came out as positive for COVID-19 last March 21. Done at RITM, and 2 consecutive negative results in April 3 and April 7. Then finally discharged in April 14, and he is tagged as PH373, the first confirmed case and first recovery case of World City Medical Center. The initial preparation of the hospital was focused on the readiness of facilities, logistics, and competency of healthcare providers to care for this emerging disease. First thing that we did was to have an isolation area. We converted a container vans into isolation room located adjacent to emergency room. We were inspected by the Department of Health and we were commended for having this innovation. Triage is the first point of public contact with the emergency room, and it ensures that most critically ill patients gets medical attention on priority without delays and screens COVID and suspected COVID cases, whether patient is in an emergency room and also screening patient going to OPD. At the triage, we have a health declaration form. It is a tool being used to screen all OPD inpatients and employees to any suspected COVID cases or having a symptoms of COVID-19. Due to social distancing, even elevators are limited with limited capacity every time it is being used, and queuing system in the OPD in a limited capacity too. We also have designated elevators, one for employees, one for COVID and suspected COVID cases and one dedicated for clean cases. And disinfection is being done every hour. We also have designated area for COVID positive and suspected cases. In what is very peculiar in this ward is a room or an area for donning, doffing, decontamination, and pantry. This is not usually done in a normal practice before COVID-19. Donning is a procedure for putting on the personal protective equipment of our nurses. Doffing is the procedure of removing PPE. The contamination room is being used to have the process of cleansing an object or substance to remove any contaminants such as microorganism or any contaminants from infectious disease. We also have a dedicated pantry for all nurses and nursing assistants and orderlies. Because during unmasking activity, when they are eating, this is the time that we identified as one of the root causes of the transmission of infection. We also have the cover-all transport every time the patient will be transferred or transported to for diagnostic test. We also devised departmentalization of admission per case. This is to ensure that we have proper cohorting of cases and be able to identify the proper usage of PPE per area and safety of everyone inside the hospital. We identified one ward, exclusive gynae cases, pediatric cases, non-infectious. Ward 2, suspected cases for COVID-19. Ward 3, COVID-19 positive. Ward 4, internal medicine ward, non-infectious. Second, in operating room and delivery room and recovery room, we have dedicated OR suites, dedicated delivery room and recovery room suite for all suspected and COVID-19 positive patients. We also devised plastic barriers to contain any contaminants, infectious contaminants, and it is being disinfected every hour. We converted our pediatric intensive care unit into a place or an area for suspected case for COVID-19 unit for neonates. We also have quality check being headed by infection control nurse and safety officers being done on random checking and routine checking. This signage, like notice, no visitors allowed. For normal Filipinos, we normally do not like this. The normal Filipinos are being visited by families, especially on Sundays, and there are usually in a bunch. But now it is strictly and in limited capacity, and in our standard, there is only one competent significant other who is allowed to be with the patient. We also have innovations on hand hygiene. Since there are mobility limitations, medical supplies, equipment in the initial phase of having COVID-19 were requested. However, there are late deliveries, so we opted into innovations. We performed for the first time the hemoperfusion. Hemoperfusion is a treatment technique in which large volumes of patients' blood are passed over an absorbent substance in order to remove toxic substances from the blood. This is the statistics of World City Medical Center healthcare workers with confirmed COVID-19. Among physicians, we have a total of 8 physicians inflicted with COVID-19. Nurses, we have 13. Nursing assistants and orderlies, 4. And other departments that includes ancillary, laboratory, diet, and housekeeping, a total of 8. So all in all, we have 33 COVID-19 positive healthcare workers. As you can see in the graph and in the presentation that I have, most of our positive employees with COVID-19 positive was diagnosed in the initial phase of having COVID-19. That was in March and April. So we had our root cause analysis of the the result of this is that there are patients who are not declaring that they have the symptoms of COVID-19 and at the same time they have travels. There are many challenges that we met during the pandemic. Number one, for nurses. Nurses felt the stigma, discrimination from colleagues and community. Nurses were perceived to be carriers of coronavirus due to clinical exposure to COVID-19 patients. Second, there is an immense fear due to sudden death of patients, deaths of colleagues like doctors, nurses, nursing assistants, and orderlies in other hospitals, and some on quarantine status and contracted the disease. This resulted to resignations, staff shortage, limited patient admissions, and reassignments of staff nurses. Third is the confusion and stress due to constant change in processes to adapt to the new directives of Department of Health, standards of WHO pertaining to this emerging disease, such as schedule of RT-PCR testing, second, time frame of quarantine and return to work standard, third, use of personal protective equipment according to area of designation, and fourth, there was no established clinical pathway in the initial phase. Fourth is the training and awareness programs usually done face-to-face method and shifted to online platforms due to social distancing requirements. Fifth is due to fear of contracting the disease, clerks and other admin personnel opted not to report on duty and or work from home arrangements. Hence, nurses assumed the responsibilities during pandemic. Six, resistance to mental health and psychosocial support. Seventh, shortage of PPE due to increased demand of supply from different hospitals and institutions in the initial phase. 8, shortage of RT-PCR testing kit resulting to delayed results and management in the initial phase. And 9, difficulty in making formal referrals because majority of the physicians opted telemedicine consult. So as a nursing leader, I asked myself, what about care for the carers? Upon assessing the need of my staff, I coordinated immediately to the management and other authorities regarding the need that we need to provide in order that our staff are safe and happy to serve our patients. Hence, we were approved of an additional benefits like risk allowance, free meals, transportation service, insurance, free accommodation, and free vitamins. We also witnessed bayanihan. It is a core essence of Filipino culture. It is helping out one's neighbor as a community and doing tasks together, thus lessening the load and making the job easier. Our top leaders shared their percentage of their salary just to provide free meals to our staff. Doctors gave their share and the community as well. Despite of my efforts or many efforts in other aspects during pandemic, as a nursing director, I thought it was enough until one concern brought to my office that one of my quarantined staff is manifesting suicidal thoughts and seems to have imbalances in her emotions. I tried conventional methods until I have assessed that I needed to call an expert who can do the psychosocial care amidst pandemic. I am involved in some of their scheduled therapies, and I felt the immense importance of having an institutionalized program on this. Daily, I would check her progress. Even in the middle of the night, I am awakened just to check her status. Thank God everything is now back to equilibrium with the help of our mental health nurse practitioner Ma'am Betty Merritt. Another concern is one of my supervisors was diagnosed positive to COVID-19. Very critical case and fully recovered now, and now back to the routine grind as a nurse. So we decided that we celebrate our Nurses Week last week of October to have a virtual recognitions and celebrations. We were accorded free coffee for our staff. Instead of having big gatherings, we are sufficed now with free coffee. We use the power of social media. This is to lighten the mood of the staff, and they are all actively participated in the contest of TikTok challenge, and they were awarded the top 3 most viewed and had the number of likes in the Facebook. Not only that, even the nursing leaders are also dancing leaders. Nursing leaders dance to inspire our co-workers, our co-frontliners, and send a message of hope and gratitude. We also encourage our COVID survivors and our staff to speak up about their experience and inspire other frontliners. Aside from recognition to our staff, we also provide tribute to our recovered patients every time that they are for discharge. Now, we have a lot of learnings out of pandemic. One is adaptability and flexibility to changes. Second, strengthen emergency preparedness and crisis management program in the hospital. Third, strengthen psychosocial care for nurses and other frontliners. Fourth, synergy of medical, nursing, admin, and ancillary team. 5, as a leader, we should have clarity of mind. 6, limit communications to what is necessary and helpful. 7, read valid and credible sources of information, because having a right information is having power. And number 8, we turn our challenges into opportunities. My challenges as a leader is not only as a nursing director, but also as president of PNA, or Philippine Nurses Association Zone 3 Inc. So we created a program, Care for Our Carers. So we call for donations, and there are so many donors that responded. And in March 2020, 68 hospitals, institutions received chairs from PNA Zone 3, Quezon City, and Marikina. And we also have distributed vitamin C to every hospital that are under Quezon City and Marikina, or PNA Zone 3. We started research. It is entitled Hospital Practice Environment and Support Mechanism among Quezon City and Marikina City Nurses during COVID-19 pandemic. This is a collective voice of all nurses within our scope, Quezon City and Marikina City. And all the recommendations out of this research shall be converted into tangible programs of Philippine Nurses Association Zone 3 Inc. We also devised a chat room, or a messenger, wherein the group of leaders under Marikina and Quezon City has an initiative to have a forum of nursing leaders to discuss current trends, issues in real-time networking, instill camaraderie, strong arm in cascading, and institutionalization of plans and programs of PNA Zone 3, aligned to PNA National, our mother organization, and establishing volunteerism programs during disasters and emergency preparedness. With all that I have mentioned, in summary and encapsulation, we want to celebrate nurses And in the incoming webinars and incoming programs of PNA Zone 3, we will have the theme Resilience, Excellence, and Convergence. Thank you very much. Gracias.